As the coronavirus officially reached what the World Health Organization called a pandemic level today, here at home, the Minnesota Department of Health has confirmed 5 presumptive cases, all within the last week.
They are considered presumptive cases, but CDC considers presumptive cases actionable, and in fact is actually considering not requiring the cases to be confirmed at CDC.
Health department officials say they're testing at least 100 people a day here in Minnesota for the virus, but not everyone who has had known contact with a confirmed case is being tested.
So if you don't have any symptoms, there's no reason to test. So the only people that are getting tested are those who are symptomatic.
Health experts say there are 3 risk categories that are factors when considering to test. Low risk, meaning sharing the same indoor environment as someone with a confirmed case. Medium risk, meaning travel from a country with widespread transmission. And high risk, meaning international travel from China or providing care for someone with a confirmed case in a non-healthcare setting. According to the CDC, the decision of when to test is solely up to the state and local health departments. With more than 1,000 confirmed cases here in the U.S., resulting in 29 deaths, health officials say more testing labs are needed.
Additional laboratory partners will be coming on with the ability to do testing. Some have come on at the national level.
And if you are diagnosed or experiencing flu-like symptoms, your best option is isolation.
Our recommendations for staying home when you're sick and things like that, those are not just for individuals who are in the high-risk group. That's for everyone.
Yeah, and health officials say the reason why so many people are being tested every day is because it's still flu season and symptoms of the coronavirus are very similar to the flu, so they're testing to rule it out.
All right, good information to have. Thanks, Devon.